would wash my hands because that's important for infection prevention. Hi, my name's Autumn. I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment. Can you tell me your name, please?
Betsy, nice to meet you.
It's nice to meet you. Okay. I would have assessed vital signs. Blood pressure was 116/60, heart rate 72. Oxygen saturation would be like 98% and temperature would be 98.5. They're all within normal limits. So the first thing I'm going to do is just look over your skin and your head. Okay. So I'm just going to kind of look at you on your scalp. Oh, sorry.
That's all right.
Skin is pink. Temperature is warm bilaterally. One small lesion on the scalp. Head is normal cephalic. Hair is thin and dry. There's without parasites. So now I'm going to look at your eyes. Actually. Oh yeah. Okay, I need you to close your eyes for me. And you tell me which side I'm touching, okay?
Right. Left.
And touch your forehead now.
Left. Right. Left. Right.
The trigeminal cranial nerve is intact. Okay, can you smile for me? Okay. Raise your eyebrows. Close your eyes. Okay. The facial cranial nerve is intact. Okay, now I'm going to look at your eyes. Okay, eyes are okay, now I'm going to look at your nails. Nails are translucent, they're trimmed. Capillary refill is less than 3. Okay, now I'm going to look at your eyes. Eyes are symmetrical. Eyebrows are, they're symmetrical, thin, blonde hair. Pupils are perla, they're equal and reactive to light. Okay. Can you look down for me? Over to the side. Other side. Oculomotor, the cranial nerve is intact. So now I'm going to have you look at the eye chart. I'm going to cover each eye. Do you wear glasses at home?
To read.
Okay. I'm going to cover your left eye first.
F-E-L-O-P-C-D.
Okay.
F-E-L-O-P-C-D.
Okay. Ocular cranial nerve is intact. You would use an ophthalmoscope to look at the ocular fundus and to further assess the eyeball. Just going to put that on your eyes. Sclera is white and conjunctiva is pink. Now I'm going to look at your ears. Ears are symmetrical. There's a small amount of shortment in them. I'm going to whisper a word in this ear and you're going to keep that ear closed. You're going to tell me if you heard it. Okay? Keep this ear closed.
Fireball.
And do the other ear.
Firefight.
Good job. Okay. The acoustic cranial nerve is intact. Now I'm going to look at your nose. First of all, I would use an otoscope to look in the ears to further assess the eardrum and ear canal. Now I'm going to look at your nose. There's no lesions. Nose is midline. When you place your hand on one ear and blow out the other one. Okay, can you do it the other one? Okay, ears are intact. You would, the olfactory cranial nerve will be assessed here now I'm gonna look at your lips. They're symmetrical, dry pink. Open for me. Tongue for me. Okay. Teeth are present. The buccal mucosa is uniform. The gingiva is pink. No edema. The hard palate is white, and the soft palate's pink. Everything's intact. Okay, and the uvula is midline, and tonsils are good. No swelling. Okay. Then we have two cranial nerves we would assess here: the glossopharyngeal and the vagus. The tongue, tongue is uniform, and it does not. It's bilaterally, so your hypoglossal cranial nerve is assessed there. So now I'm gonna look at your neck, and I'm gonna palpate on your lymph nodes. Okay.
Okay.
Skin is uniform and pink. Can you do this for me? Can you lean your head back? Move it from side to side. Okay. All muscles are intact. That is the spinal accessory cranial nerve. Okay, so I'm gonna assess the lymph nodes, and we're gonna start back here. No lymph node swelling, so you look at the occipital, posterior, auricular. I can't read it. The jugular, the supraclavicle. Okay. Okay, so now I'm gonna palpate on your carotid arteries, but I'll do one at a time. I'm gonna listen to you. You'll have to hold your breath, okay? Okay. Pulses are regular, equal, bilaterally, no signs of bruits. Bruits are a sign of stenosis of the carotids. Okay. So, in assessing the lungs, normally you would have the patient without a shirt on, and you would assess their skin, see if there's any lesions on their lungs and their thorax. So first what I'm going to do is tactile rheumatism. So I'm going to have you say 99 for me.
99.
Okay.
99.
Okay. So now I'm going to percuss the lungs. They're resonant, which is within normal limits. And then I'm going to listen to them. Couple more times. I gotta listen to them now. Two more times and that's it. Lung sounds are equal bilaterally, clear, no abnormality noted. Okay, this is the part of an assessment where you would do like a breath assessment. And the first thing you're going to have your patient do is, of course they won't have their shirt on or anything. You'll have them take their arms and raise them up, which you don't have to do this. And then you will check for symmetry. Then you would also have them put their arms on their hips and check for symmetry there, and then push their palms together. Then you would, I'm going to have you lay down though. Then you would have your patient lay down. You would have them hold their arm up above their head. You would feel for the lymph nodes here. And then you're going to, you would take your hand and you would fill in a circular motion, and you would check the nipple discharge also. So you would do this for each side of that. Okay, so you can sit back up. Okay, I'm going to ask you a few questions, okay? So during this assessment, the facial expressions have been appropriate to the conversation, to the mood changes. The speech is appropriate. It's easily detected, easy to understand. Okay, how do you feel right now?
Good.
How do you usually feel?
Good.
Patient has mood is appropriate to conversation and cooperates well. Can you tell me your full name?
Sarah Betsy Davis.
What day is it?
Sunday.
Where are we at?
Mount Warren, Arkansas.
Okay. So, patient is oriented to person, place, and time. The attention, the thoughts are focused. I'm going to have you do a little task, okay?
Okay.
It's easy. I'm going to move the table back and see if you can follow me. Can you pick that up with your left hand? Switch it to your right hand. Take a drink. And then put it back down. The patient is focused and can follow commands correctly. Okay, I'm going to ask you a question. Can you recall what you've had to eat in the last 24 hours?
Yes.
Okay, what was it?
Pizza, biscuits, chicken last night.
Okay. So, I'm going to ask you questions about like your past events. When was your anniversary?
When was my anniversary? July 28th.
Your birthday?
November 26th.
What was your very first job?
I was a waitress at a pizza restaurant.
Patient's memory is intact. I'm going to give you four words, and I want you to repeat them back to me, okay?
Okay.
Brown, honesty,